Hi, everyone. I'm Ben Gonzalez, and this is TDI. Today, we're going to be talking about health insurance options if you had coverage on the job and you no longer have that job. So joining us today is Misty Highnote from our public affairs area. Hi, Misty.
Hi.
So if you were getting your health insurance at work and then you find out you no longer have that job, what do you do?
Right. One option is to continue the plan you had through your job through federal COBRA protections.
Okay.
But you'll have to pay for the premiums yourself if you do that. So just keep that in mind. Another idea is to start shopping for a plan on your own. There are also short-term plans that could cover you until you find a plan that you really like, but be careful with short-term plans and just ask about what they do and don't cover.
Okay. So you can either go directly to an insurance company or someplace like healthcare.gov. But for healthcare.gov, that's only certain times of the year, right?
Right. For healthcare.gov, there is an open enrollment period that's usually in the fall, but there's an exception if you've lost your job or a few other cases, you can qualify for something called a special enrollment period. So that would apply in cases like this where you need coverage because you lost your job. But be careful, you only have 60 days from when you lost your job to get a new health plan. So don't procrastinate, start looking.
So that's that special enrollment period then.
Yes, yeah. And you could qualify for a special enrollment period any time of the year outside of that open enrollment period in the fall.
What about costs associated with the healthcare.gov? Because, if I've lost my job, money could be tight there.
Right. And that's one reason to go to healthcare.gov is that you can possibly qualify for a subsidy. Now it's income based, so it depends on your household income, but you could qualify to lower your premiums by getting that subsidy. That'll help with your cost.
All right. Any other options out there, alternatives we can look at?
I'm sure you can ask your spouse's work. If your spouse has a plan through their job, you could possibly get on that. So ask their benefits coordinator about their plan. And also, if you're under 26, you could possibly get on your parents' plan. Federal law says that plans have to cover you till you're 26, so ask your parent about their plan. And then there's also, if you're a member of a church or if you go to college or if there's an association that you're a member of, sometimes they have group benefit plans. So ask them too if they have a plan that you might be able to get on.
Now, on the getting on with your parents' plan, do I have
Mhm.
to be a full-time student or going to school or anything like that?
No, no, you don't have to be living with your parent. You don't have to be claimed as a dependent. You can also be married. You don't have to be living with them. You could be going to school. You can also have a full-time job. As long as you're under 26, you should be good.
All right, sounds good. So that's what the options are for you out there. You can either shop directly with the company, go to healthcare.gov, maybe explore some of those other options through your schools and your churches. So if you've recently lost coverage, there are some options. If you need help remembering or going through some of this information, you'll find it on our website. That's tdi.texas.gov. You can also call our helpline. That's 1-800-252-3439. We have people there during business hours, and they can go through these options with you. So for Misty Highnote, I'm Ben Gonzalez. This is TDI.